to restore health as quickly as we possibly can restore it to our patients, and also to give them the opportunity to turn things around. What you have to realize is that, as I say in my book, your health is a do-it-yourself program, and you need to understand that it's about what your immune system is. I made the comment a little while ago that most people don't realize that they have Lyme's, and it's because the identification of it is a very specific fingerprint. And if you don't do and look at all the pieces of the puzzle, then you're not going to pick it up. There are tons of specific bands that are accepted throughout the world in the literature, and we only do a few of them in traditional testing in this country. The lab can be a junk lab that invests nothing into optimizing the Lyme's identification, as far as I'm concerned. And if your clinician wants to use the ELISA only, the Western blot or the ELISA, just take off. There's other things to do. You're wasting your time and you're wasting your money, and you're missing, I think they're missing, the most obvious markers that would clearly define it. If you have a history of bullseye rashes, it tells you that you had a spirochete that bit you, and you don't have to have that bullseye to be positive, because sometimes it happens, it's very small, and you don't see it. It's gone, but you have other types of situations that begin to show up. It's extremely important that you use all the functional capacity that's available today. And again, we are economically driven in this country, and if we don't have that, it usually is a problem, and is a situation that never goes away. Practitioners are not aware of current treatment approaches that are being used all over the world. Practitioners who follow year after year after year of IV treatment, of antibiotic therapy, as far as I'm concerned, don't know that there's other things out there that are as effective. 10 years of Lyme disease treatment is not acceptable. When you're treating a patient the same way over and over again, supposedly cure something, and the pathogen keeps showing up, guess what? You're not curing anything. It doesn't go away. Some treatments are useless, and for one of them, by the way, it's being used, and it's a great treatment for a lot of other things, but it's used for Lyme's patients. It's the hyperbaric oxygen chamber. Great thing for neurological problems and other immune system problems, but not for Lyme's. I haven't seen the data that supports it. The research that's been done with the hyperbaric chamber has been used in small animals, mice particularly, but not in humans, and the results just aren't there. If you go through the literature, you'll find that people who receive, after 120 treatments, this one study shows, using a 90-minute application at 2.4 atmospheres of pressure, all the participants that participated in this still had positive findings for all the primary infections of Lyme's. It just doesn't work. There's no validity there. So when you have that type of a negative result, why continue the process? So there's other ways. Physicians are trying to treat sick patients, and when I've talked to other doctors who do the kind of functional work that we do, we share back and forth, and most of them are beginning to look outside the box, because they realize that what they're doing, or what they have been doing, just generally isn't working. The current literature says, IV treatments with synthetic antibiotics or whatever is the way to go. Not so much, not in my opinion. You're listening to Dr. Tom Roselle Live. I have been in studio at 888-630-9625, 888-630-WMAL. We have about 4 minutes, so if you have any questions, please give me a call. Always go to our website at rosellecare.com. That's ROSELLECARE.com, and check it out. Not only check it out, but you're also going to find a connection to two things. One, you can receive an ongoing newsletter, absolutely no charge, our gift, but also click on Facebook. It's our web connection to you with an ongoing blog. We post information to help you help yourself. usually every other day at the latest, and topics that will inform you about when we do classes. I just did an introductory presentation this last Wednesday evening in our office, and it was packed. And I'm sorry that we had to tell a lot of you that there was no more room. However, we're going to be doing a series of 4 more presentations on my book, Ageless Health 101, Health is a Do-It-Yourself Program, by the way, which is available either through our website at rosellecare.com or on Amazon.com. Either way, you can go get it. Barnes & Noble also is carrying a version of it. So you can pick it up in 3 different ways. Love to have send a copy off to you, and would love to have you as our guest at the next presentation. So check our website out, and it'll give you the dates of when that's going to take place. It was a fun filled evening and gave you a lot of information, and I intend to give you a whole lot more the next time through. Talking about Lyme's today, and we've been talking about the application of something called biophoton therapy, very similar to low-energy light laser, which we use in our office, and why Lyme's often is misdiagnosed because of either the unwillingness to use or the inability to know about or lack of information about the different types of markers and bands that are actually out there and the different labs that are offering much more definitive diagnostic value. Now, Dr. Wutzel, Ingo Wutzel, who we've been talking about, is a medical physician out of Germany, and he has used biophoton therapies in conjunction with other modes of herbal therapies and sometimes, but not too often, medication, to treat Lyme's over the last 9 years. And the research on this goes back to 1923 that was brought about by a Russian medical scientist, a guy by the name of Alexander Guvich, and who called the process mitogenic rays. Biophotons were widely researched in Europe and in the United States, by the way, in 1930s. And we're just getting back to its application. It boggles my mind sometimes why we don't use the things that we need to use. And the thing that has to be noted is that each cell of your body has an electromagnetic field that when it vibrates, when its frequency is a normal level, you're well. When it's not, you're not. And that when things get in and your body is more susceptible to bad things happening to you, you begin to break down and show the problem. So, you know what? Do your research. Go into our website, rosellecare.com. Listen to me every Sunday at 12 noon, and I'll try to give you more information. But you know what? Don't believe me. Believe yourself. Do your homework. This is Dr. Tom Roselle. I'll see you next week at 12 noon right here on WMAL. See you then. Bye.
Thank you.